Welcome back. Cancer is on the rise in young people, and that does include breast cancer. We have Dr. Erin Rush. She is a Cleveland Clinic oncologist joining us this morning. Thank you so much for being here today.
Thank you for having me.
Unfortunately, we're seeing this trend in all kinds of cancer, colon cancer being another big one. But breast cancer, I know we start screening at 40, but women are getting this at younger ages. And is there an explanation for it that we can wrap our heads around?
Yeah, so I think we certainly are seeing this trend, and I agree. We do recommend initiating screening for an average risk woman at age 40. However, there can be other factors that might increase an individual's personal risk of developing breast cancer, and there are tools available to help identify who those women are, and then they can be referred to breast health specialists to discuss supplemental screening, for example. But things such as genetic alterations or mutations, such as BRCA1 or BRCA2 gene mutations, history of breast biopsies showing atypical cells, dense breast tissue. Those are just to name a few of the factors that can be associated with elevated or increased risk.
I want to get into more of that, but one of the things being addressed right now is just the fact that younger women face some challenges when they are diagnosed with this. So, and you would know that more than anybody else, what those challenges are. So I'd love for you to expand on that a little bit.
Yeah, so again, with this trend, we're seeing, younger women being diagnosed with breast cancer, and they certainly face or have a unique set of needs, just purely based on the time of their life during which they're diagnosed. And so cancer treatments can pose challenges to the lifestyle things that are occurring, such as developing careers, relationships, being in school, starting families. And so, for example, I think importantly, fertility is one of these things that we can see be affected by cancer treatment, such as chemotherapy, endocrine therapy, but also the time of life during which a woman is diagnosed and treated can also occupy a time that they may be interested in starting a family. I think also psychosocial issues, body image, all of these things can be seen differently in younger women.
And the Cleveland Clinic is always on, the innovators. Everything that the Cleveland Clinic does is innovative, I feel like. And I know there are ways constantly that you're growing and changing to be able to help in certain situations, this being one of them. What are the ways the Cleveland Clinic is really jumping on board in that sense? Yeah,
so the Cleveland Clinic has a strong interest and focus in taking care of young people with with cancer, including young women diagnosed with breast cancer. So efforts in this space include optimizing navigation for patients during this process and their journey, and importantly, making sure that patients are aware of and have access to all of the resources that we have that can help them. And this may include nutrition referrals, genetics, integrative medicine, to name a few, but really the list can go on. I think also importantly what we do is we have a focus on multidisciplinary care. And so what that means is that patients meet with us at the time of their diagnosis, and us being myself as a medical oncologist, a breast surgeon, perhaps plastic surgery, radiation oncologist, and we try and outline what their treatment plan might look like. And this can be overwhelming, at the beginning, but we find that it really helps people understand, what things might look like. And obviously, providing the psychosocial, support with social workers engaged at that time too is really important.
I think that's so important, because I think any woman who's gone through something like this knows that the mental aspect of things is often much harder than the physical. So the fact that that is also offered from day one, and I remember that, I thought, wow, like do I need somebody? But I did. And so screenings, I know guidelines, we start at 40 as where current screenings are. But what if someone might be high risk, or they want to know if they have dense tissue? You can get the risk assessments done, correct? And then that opens up even more tools if you are high risk.
Yep. So I had alluded to some of the factors that can increase risk. I think that these tools are really valuable to help individuals, women, be able to understand their personal risk of developing breast cancer. And then I think I would encourage, again, discussion with a specialist that focuses on breast health to really discuss what supplemental screening might look like, such as in the way of a breast MRI. What are the risks? What are the benefits? And to help better understand if someone is a candidate for that approach, so that they can make that decision if that's something they're interested in pursuing.
Well, and I know a lot of people they've either been through a traumatic experience with testing, or they don't necessarily believe in certain things, but I think that the best thing for everyone to do is to find the plan that works for you. Talk with your doctors about it and figure out what will put you at peace in your heart? And that might be different from one person to the next. So I think just having that open communication with your doctors is probably the best part about all of this.
Yes, no, I agree completely. I think we talk about, breast awareness, but to your point, I think, a certain approach might fit for someone and might be a bit different for someone else. And so it's really kind of understanding what a woman's goals are, making sure that as best as possible they're informed, and that we're there to help guide them through decision making in this whole process.
Well, we're so blessed to have you all here. I'm grateful to the Cleveland Clinic, and I know so many others are as well. Thank you so much for coming in today. And if by chance that would be something that would be in your future and you do need an oncologist, keep Dr. Rush in mind because she seems absolutely fabulous. So thank you so much. I appreciate you coming in.